Welcome to Body Best Doctors. We're going to do a knee evaluation, or knees I should say. Bend this knee up, bring it up to about the level of where the knee here is with the foot. Then we do an anterior posterior cruciate ligament, which is in the center of the knee and crosses and holds the biggest joint in the body, the knee, together. And they can get injured, and then if they're not fixed, it can be a problem. So we first check the anterior cruciate ligament by pulling the knee out, and I can see here how much it moves. It's pretty good. And then we can check one side compared to the other, then the posterior cruciate ligament, and those are good. Now the next two ligaments, leg down flat, is what we call the inside and outside, the medial and lateral. So you just place the hand, if you're going to check this one, on the inside, and then I take here and we're going to stretch it this way and see if we got any play in the knee. And it's solid. Then I switch my hands and the foot and the knee and check the medial collateral ligament on the inside. So then we'll do both of those both knees. This one's perfect. Bend this knee up. I just sit on it so it doesn't move, and we bring it towards me. Now this one has a little more play. Can you feel that? So this has possibly been slightly injured, and so her cruciate ligament, anterior cruciate, is a little bit weak, and it basically lets the knee slide and ultimately can wear out the knee because it's not holding it properly. So now we'll check the posterior. That one's fine. All right, leg down. Now we'll check the inside, what we call the medial collateral ligament. I hold here on the inside and then hold out here, and then I push this way and see if there's any play in the knee. That's perfect. Now we'll do the lateral on the outside, same thing. That's perfect. So in this patient we found a little bit of strain on her anterior cruciate ligament. The test, if the ligaments are okay and the knee is having pain, you can also take x-rays if you have an x-ray machine, or send them out if you want to look at it. But I usually don't. I just test it this way, and then I would do therapeutic ultrasound on the knee, if it's on the inside or the outside, for 5 minutes. And the extra calcium that builds up in joints with the therapeutic ultrasound, it takes the calcium right out and the pain's gone. It's absolutely amazing. The other thing that we find, we test people on a digital postural analyzer and test the balance of the patient before we treat them. And if they're showing off balance, then the scales will show off balance. 0 to 5 pounds is fairly normal. But if the weight on one side is more than 5 pounds, then that means they're completely stressed off balance. When you need to find out where, from the head to the hips, so to speak, and reset them. And then before they leave the office, after we've corrected it, they're balanced. And they say, wow, that feels much better.